Okay. All right. So Reagan, we've got about 11 videos or so that we're going to see. I'm going to be stopping the videos every now and then and throwing out questions. And then I've got some questions in between too that are very similar to what are on the exam. And at the very, very end, we're going to do math calculations because some of the machines don't have the calculations to tell you what percent nitrous you're giving to a patient. And I want you to be able to do that in case you're at a different office or they've got an older machine or whatever, because those machines are built really well and they last a long time. And you know, the parts are around for a lot of them and everything. So there's a lot of them still in use. So do you have any questions right up front?
Nope. Sounds good.
Okay. And then like you said, if you have uh if you want, here's somebody. Okay, let's see. All right. We've got iPhone 2, and I'm not sure who that is. We'll give it a second here. So at about an hour or so, we'll take a break and let you get something to drink or whatever. Okay. And who is
Okay.
iPhone 2? I see registered. Can you?
Oh, it's me. I'm Eduardo.
Oh, Eduardo, hi. Out in California. Good to
Yes,
hear.
California.
Very good. Well, thank you very much. So we're just about to get started. We've got about 11 videos to watch. I'm going to be throwing questions out at you, and then I'm going to need you to bring up the chat feature so I can ask it, and then you answer it with chat rather than talking with me, okay, over the speaker.
Okay.
And we'll stop at about an hour or so and take a break for about 5 minutes, and then we'll keep going. So anyway, and we've got Reagan on the line. Eduardo, what city are you in?
San Francisco.
Ah, very good. And then Reagan is in he's still
Columbia.
Columbia,
Woohoo.
Missouri. All right. So let's get
Oh, I thought
started.
Colombia.
No,
No, no, no, no, no, no. I wish.
Okay.
great. So can you see my screen all right, Eduardo?
Yes, I do.
All right, I'm tickling it around here. Okay, so we'll get started on our first movie. So this is just an introduction to show what a patient looks like that is under nitrous oxide. And remember, nitrous is just supposed to make the person feel calm and relaxed. They should still be with it. You still have to use local anesthetic. We just want them very relaxed. We don't want them asleep. If they're asleep, they're in a different stage of anesthesia, as you saw from your lectures and everything. So again, nitrous is just supposed to make them relaxed, unconcerned, floating. Some people are happy, slightly numb, because it circulates everywhere in the body and it just kind of disconnects them. It's a great feeling. And if you haven't tried it, you ought to give it a try. So we always want to see deep breaths through the nose, no talking. And some of the things that they say in this movie, if there is an inner ear infection, it's not advised to use it because of the difference in the nitrogen and the nitrous oxide. But people with asthma use nitrous. So if you can still see the boy that's there, his lips are kind of turned up. He should have some safety goggles on or glasses. And that's just the way you want them. You don't want them too deep, just very calm and relaxed to help get through the dental procedure. But like I said, you still have to use local anesthetic. So we're going to start now with our first question. So if you answer me on the chat. All right, very good. It is all of the above. Excellent. And it's important that we do that. Some people just cannot have it. Somebody that wants to be in control, doesn't want to let go. Their anxiety is just beyond, and you can't get them, you can't treat everybody with it, but it works on the majority of people. So we got to make sure that they can accept it. Some people are claustrophobic, and to put that on, I let them put the nose piece on by themselves so that they don't worry about the claustrophobia and that they are in control to take it off. So let me ask you this question, and you guys can chat me. Is it all right if the person says, no, I can't take it, and they rip the mask, even though you've been running maybe 30 or 40% nitrous? Is that a bad thing? Can they take it off? Is it the worst thing in the world? I don't see Eduardo. So, Eduardo, are you still there? Oh, it's not the worst thing, but.
Yes,
Right,
I'm still here. I was typing. So
exactly,
basically that would be violate consent.
right. So if the person says no, then it's no, and it is
Yeah.
not the worst thing in the world, because they're still gonna be breathing 28, or I'm sorry, 21% oxygen. All right,
Mhm.
you guys can see me drinking, but I'm not drinking a beer. This is sparkling water, okay?
Okay.
Very good. So anxiety, that is one of the many things that nitrous oxide relieves. And this slide is to remind you that when you put a patient on nitrous oxide, let them feel what they're feeling. So a lot of them will ask, what should I be feeling? And you should, rather than putting ideas in their head so that they won't be disappointed, you tell them that, you tell me what you're feeling, you know? Well, I don't feel anything. Well, then you're going to go ahead and turn up the percent of nitrous oxide, that sort of thing. And then they'll start to say, I'm feeling relaxed or whatever. You can maybe put an idea or two in their head, but they might get disappointed if they don't have everything. Again, it's circulating everywhere in the body. Some people will get tingling out on their fingers and their toes, but we want it obviously to go up into the brain where it's going to have the function that we want. Any questions? So let me ask you this. What type of system do you guys have? Do you have a system where there's tanks in a closet, or do you have a portable system or a central system? Yeah, with the tanks in the closet. Okay, good. Well, I'm going to show you both systems. We're going to start with the central system. So these are the tanks in the closet. And let me get this queued up. Now, this is an older system because, like I told you, they last a long time. So we're going to see that, but the parts are still the same, whether it's a brand new system that somebody just had plumbed or if it's this older system in kind of an old setting. So we'll look at this. So you'll have all these signs that the fire department puts on the doors. And you'll notice that for safety, we've got to have the tanks strapped at all times to the wall. If the tank is empty or you don't have enough straps, then lay it down and protect the valve on it. Lay it down on the floor. Do not let it fall or it becomes extremely dangerous. So we're going to walk into the room here and turn everything on. But that white thing that you see there is the manifold that knocks the pressure down from the oxygen tank and it delivers it to the room at 50 psi or pounds per square inch. And notice it says use no oil on there. So we've got everything off, and you really only need to turn one tank on at a time. And you know that it's righty tighty to tighten the valve, and she's going to come in and she's going to lefty loosey it to open them. And you only have to, like I said, you only have to open it one tank at a time. They become very, very expensive with the delivery and the cost of the gas. So we don't want to waste gas. If it's a big clinic, then it's okay to do that, to turn them on. But if you turn on one, let it run out, and then you can run back into the room and turn on the next tank and shut off the one. So there's Lefty Lucy with the tanks. When I turn them to the left, I always take it all the way to the end, excuse me, and then turn it to the right just a hair so that the valve doesn't get stuck there. Okay. And you're going to see the portable system is really similar to this. So let me chat me this. What is the pounds per square inch or the pressure inside a full oxygen tank? All right, very good. It is about 2,100 pounds per square inch. And as it's only gas inside the tank, so when it's reading 1,000, this is showing at about 1,000. We know that that's about a half of a tank. So what is the pressure in a full nitrous oxide tank? All right, good. So if it's just about empty, how much pressure does the gauge read for a nitrous oxide tank? It's just right. It's just about empty, but it's not empty yet. Very good. So the only way really to tell when you're just about to run out of nitrogen or nitrous oxide in a tank is to weigh the tank empty and then weigh it full, because you know that there is liquid nitrous oxide inside the tank, and it evaporates at a really low temperature. So it at room temperature, it's just totally boiling and everything. And we're going to see a little movie a little later on about that. So, all right, very good. There's the use no oil thing. So will nitrous oxide support a fire? If I were to take all of the nitrous oxygen out of the room and just turn on nitrous oxide, would it still support a fire? Yes or no? All right. It will support a fire, Eduardo. Just to let you know, it will, if, even in the absence of oxygen, it will still support a fire. So out in the hallway somewhere, you've got emergency shutoffs for your gases, your nitrous and your oxygen. So she's going to pop the cover on this, and you'll see that there's copper tubing that is directing the flow of the oxygen and the nitrous oxide. And these are called ball valves. So if you grab a hold of those handles and pull them 90 degrees, in this case, towards you, there's a ball inside this area right here. I'm going to move my right here. And it will shut off the flow of oxygen and nitrous oxide. Do you know a time when you might want to or need to emergently turn off oxygen and nitrous going to the room before you can get to the closet to turn the valves off? Okay. Any idea, Eduardo? Okay. Well, one of the things is inclement weather, we get some tornadoes. I can hear the thunder rumbling outside. You might even hear it while you guys are listening to me. I know that we've got some rain and thunderstorms coming here. I'm in the St. Louis area. But if, God forbid, there was a an earthquake in your area, you know, because we know that you guys are prone to that, I would be turning it off really fast. Especially even though you've got a portable system, I would turn it off. But another reason would be then if there was a fire in the office or there was a leak or something on this order. So anything that is usually pretty much disastrous is a reason to turn it off. So, and you can see that the pressure on these dials is reading 50 pounds per square inch, and that's what's going into the operatory. This is just a little control panel. Again, it's old, it's kind of old fashioned. There's a key to turn off the whole system. There's some instructions on how to turn the system on in the morning and shut it off at night or whichever. And it also notifies you if there's pressure low. There's the on-off system to turn the system all the way on. If the pressure in the tanks are low, they will alarm and be red. But if they're good and full, then they're going to be nice green LEDs. And you can use the test button to test the whole system to make sure everybody and everything's working electronically. And she just did that. So it's running through kind of a self-test. And Accutron is a big manufacturer of nitrous oxide equipment. There's a number of them. Porter is one, and they all make these really nice systems. Okay. Does anybody have any questions for me? I'm watching the chat. Okay. All right, good, you guys. Just for these questions, just read them carefully. You guys know it. It's straight out of the notes and straight out of the lecture. And just take your time with it. For the exam, you're going to have as much time as you need. It's going to be given live via Zoom. So, and if you have a question that you have problem with or you can't think of, then just circle it on your answer sheet and your test proctor will go back to it. So you have a chance to kind of clear your head and think about it so you don't panic. So I'm going to just show you a picture of what a ball valve looks like. Let me get that teed up. So you can see if I took this handle right here, the blue, and pulled it toward me. So if I pulled it this way, it's going to hide this ball and this channel that's going through there. And it's going to create a seal. So it's going to shut off the gas. So the gas is flowing when the handle's lined up with the pipe. Excellent. Yep. Every one of those will excrete the gas through the lungs. We can urinate it out through the kidneys, and the liver will put it into the bile system, and then we'll eliminate it in the stool. So very good. This is a portable system now. It's going to be very similar, the pressures, the amount of pressure in the tanks, and all that sort of thing, to the central system or the tank room. Let me get that teed up again. And we'll be stopping and starting that. So the parts of the system, the breathing system itself, there's the on-off valve. It's our button. It's nothing other than a mechanical valve. Back here, you can see that the other part of the green cylinder this is a cylinder, is out the back. So to shut it off, you're gonna push it toward the way that we're facing now. So she pushed the system and turned it on. This is the pressure reducing valve or the pressure regulator. It's a separate one for each tank. You can't mix up the nitrous and the oxygen, but it will step the pressure down from the 2200 down to a manageable pressure for the patient to breathe. I don't think it knocks it quite down to 50. It just depends on the machine, but here's the pressure regulator over on the other side. So that serves the same function as the manifold. By the way, what color is the hose for nitrous oxide and what color are the tanks? Okay, good. And then for oxygen? Excellent. Do you have any idea why this is kind of a silly way that they came up with it, but why they decided to color the tanks blue for any reason? If you want to flip on your mic, you're welcome to do that. Any idea why they went with blue
It-
for nitrous?
Isn't it because if the patient isn't breathing, they're blue? So
Exactly. They're not getting enough oxygen. So they
enough
start to get
oxygen,
real
right?
dusky, the lips turn blue, the fingernails turn blue. And that's the reason that we do that. So, all right, very good. This is the yoke. It also serves as part of the function of the manifold. So we've got the tanks each hanging from the yoke. And this is called a tank key. And it's going to fit right in this slot, and it's still going to be lefty loosey and righty tighty to close the valve. Notice that it's got a pin system. I'm going to show you this a little bit later to fit that on. There was the regulator to be able to tell, or the head unit, we should say, to be able to adjust the flows of nitrous and oxygen. This is an oxygen flush button. You just pump it in or push the button in, and it will pump oxygen into the reservoir bag. That's that punching bag that's right down here that I'm circling. And that is where the patient is going to get their gas that they're going to be breathing from that reservoir bag. So we want it about maybe 3/4 full. I want it a little bit full, but not empty and not look like a punching bag that you would see at a gym. So you just add enough there. That's just a flaccid bag right there, reservoir bag. So this is dead space, means that there's no gas exchange going on. So we've got fresh gas coming in. That's what she just showed you. And then the gas that has seen the patient will come out through the scavenging system. And that goes right up to the mask. So that will have to be connected, that scavenging system. It's not high tech. It's going to go to the high speed suction like that. It's going to connect in, and then there's going to be an adjustment for the amount of vacuum you turn on. And if you look right here, and I'm going to show you one other spot, there's a green spot right there, and that is the sweet spot for where the ball should be floating when you adjust it. So she's going to adjust it, and they're going to come in on this. See the black ball kind of sitting there at the bottom, and there's the green right here. So you want to turn on just enough suction so there's just right, not too little and not too much, so that the ball with suction floats about that green area, that sweet spot. And you can see that floating there. Then we'll go ahead and way before the patient comes in, we'll go ahead and assemble the nasal hood and then the little mask that goes against the patient's face. If you guys have any questions, I'm watching the chat if you want me to stop or anything. Some dentists will sterilize those, if you will, or clean those. and some will just toss them in the trash. It's up to your dentist. So now we're gonna go ahead and she's just checking the righty-tighty of the tanks. And she's showing you how to hang a tank. We're gonna hang it on those pins that we saw before, and I'm gonna show you those again. This cover is gonna come over, and then you're gonna wanna be able to get that tank pressed into the holder with all your might. So she's gonna use two hands here to go ahead and really crank that as tight as possible, and then put a strap over the tank to just prevent it from getting kicked or falling off. So here is the opening up the tank. So lefty-loosey, you can open it up all the way or part way as long as the gauges are reading. And we'll have cleaned all this stuff, obviously, before the patient comes in, and put some plastic over the head unit. Reservoir bag's about 3/4 full. You'll have visited with the patient way before this, but make sure you have them go to the bathroom before you bring them back to the operatory. So we've already looked at the medical history way in advance of this. So we want to get them comfortable in the chair, get their patient bib on, put a warm blanket or heating pad over them. There she's using the flush to fill the reservoir bag. When we're reading the black ball now, she's turning the oxygen up. You read the middle of the ball. And I like to let the patient put the mask on and not make that cinch too tight. So that's running about 6 liters per minute, which is way too much gas. And you do want to see the bag rise and fall. That means you've got a good seal with the mask. So when it rises, they're breathing out. When they're breathing in, it collapses, and that's what you want to see. So the idea is to use the least amount of gas possible, and you'll still get the same concentration to the patient, and you won't be wasting gas all over the room or out the section onto the roof or wherever that vents. Questions, anybody? I'm watching over on the chat. Thumbs up. Eduardo, are you good? All right. I wonder if we lost.
Actually, yes, I have a question.
Yes.
Because well, I don't work with nitros really, but I remember that first you start with oxygen at, let's say 4, and then you start with nitrous oxide also at 4. So that's not correct, like having both gases at the same level during treatment.
The answer is no. That isn't the way that I practice.
Okay.
What I do is I use the least amount of gas possible. Now, these machines, you can see this is a Porter machine here, may not
Yes.
even let you bring nitrous up until it's at a certain level. When I show you one of the other movies, you're going to see it's got a built-in 3 liter per minute leak. And if it won't even, if I turn the dial all the way to the right on the oxygen to righty-tighty it, it'll still leak 3. So we're always leaking oxygen. So you want to use the least amount of flow, and you're going to want to give the patient the amount of gas that they need to be in that calm, relaxed, just that nice mood, no anxiety. And everybody's going to differ. We're going to look at the bell curve later on after the break near the end of class, and I'll show you where patients like to live. So I start the patient out. If you had them both at 4, can you see me tickling the screen here with the tickling it there? You're giving them 50% nitrous oxide right off the bat. So you or Ray, the other student may not need that much. So you give them just what they need to get them into that happy place. And that's called titration.
Okay.
Kind of fun. Now, when they come back in, if that same patient was to come back in, you don't have to titrate. You'll just go to your notes and say, wow, they were running at 25% nitrous. So I'm gonna put them right on 25%. And that day,
Mhm.
you might need a little bit more. But I just don't want you to use high flows because you're wasting
Mhm.
gas. And I want you guys to not breathe any nitrous molecules for the rest of your lives as far as professionally goes, because
Mm.
it can be do as you saw in the lectures, it can
Mhm.
cause real harm. So in this movie now, she is titrating the gas. She's got the oxygen on about 4.5, and she's brought the nitrous up to 2. And we're gonna bring it to where that patient is comfortable. So that's just called titration. We give enough, see how it works. Turn it down if it's too much. There she's running it at 50%. So now at the very end, she's gonna go ahead and just wash the nitrous out. So again, it's just a titration to see where the patient is with the least amount of nitrous that makes them very happy. So there's no reason to run 50% if they're gonna be happy at 25%.
Mhm.
That makes sense?
Yes.
Reagan, are you good with that? Okay, good. So is nitrous oxide very, does it dissolve in blood? Is it soluble in blood? Does it dissolve and stay there and just keep circulating? Okay. Eduardo, you there?
Yes.
Okay. Does it dissolve in blood? Nitrous?
Well, I would say that it stays in the blood.
Say that again.
It stays in the blood.
It stays in the blood, but it's
Mhm.
very insoluble. So when you
Uh-huh.
turn it out, you've got it in going into your lungs. Your blood
Mhm.
vessels, the capillaries surrounding the lung, they're called the alveoli, where the gases are exchanged.
Mhm.
It's picked up in the capillaries, brought to the heart, and distributed all throughout the body, but it does not want to be there. So we're kind of
Okay.
forcing it into solution. So when we turn it off, it rushes out of the bloodstream. It does not dissolve easily at all in blood.
Mhm. Okay.
It will rush out, which is nice. The anesthetic gases I use in the operating room do dissolve in the blood, and it takes a little while, and you have to time it so that when the surgery is done and you want the patient to wake up, because it stays soluble in solution, you got to turn it off at the right time and then crank the oxygen up to breathe the gas out. But in this case, it comes out so fast with nitrous oxide, it's so insoluble that we want to really crank up the oxygen to make sure that they don't get hypoxic or low oxygen with all that nitrous oxide rushing out of the bloodstream into the lungs, into the alveoli at the end of the case. So are you guys good on that? You want me to say it one more time? You okay? All right.
Yes.
Eduardo,
Mhm.
you're good? Okay. It's
Yes.
me,
Mhm.
I make movies in my head. So while I'm telling you that, I see a movie of nitrous oxide coming out, just like the pictures we had in the lecture, rushing out and saying, goodbye, I'm out of here. And then the patient's going to breathe it off. So, all right. So we'll take 5 minutes and breathe that off. And then you don't have to write a gigantic note um, in your chart, but I would chart what your patient says as far as that goes. And you're going to turn off your tanks now when you're all done. Righty tighty, remember? So she's going righty tighty. And then she's going to hit the oxygen flush to get the gas out of the system. And turn off the machine. And just write a note there. Now, when you sit the chair up, they might be, even a young patient, might be a little bit dizzy. So you want to be really careful and help them to either a wheelchair or something so that they don't fall or trip or anything. even though it's a younger patient. Think about the fact that the person is feeling really severely nauseous. There you go. All right. Yes. So if they should not be experiencing any of these bad things, nausea. Some people will throw up, severe dizziness and sweating. They're way overdosed. So we need to go ahead and either turn the nitrous off, which I probably would do, and retitrate again, or they may not even want it at all. It might be such a bad experience for that patient. So that is oversedation. I want to show you when you're attaching the tanks to these machines, what can happen if the tank is not on there tight enough. So let me get this queued up. So this is in the operating room. Obviously, we've got all kinds of different colored hoses and all kinds of things, but we still follow the same code. So the yellow hose is medical air. The purple hose here is for waste gas. So the exhaust gas goes in there. And then you guys can see right here, there's a green hose and a blue hose. So this is a tank, an emergency tank we keep on the back of the anesthesia machine. And I'm going to use the tank key and listen to what happened. So the tank wasn't on there tight. So what I did is I turned it off. I loosened it back right here where I'm tickling the picture. And then I reseated the tank and really tightened it down because it was leaking pretty badly. All right, excellent. It's the manifold. That's where the gases are collected under high pressure and they're knocked down to a manageable pressure that the patient can see and it won't hurt them because 2,200 pounds per square inch is a little over a ton, and that's a lot of pressure. So we've got a different type of connector. I want to show you from the OR what we've got because they have these in some dental offices. So again, let me get this teed up here. And these are going to be quick connects. Okay. So we've got the same colors I showed you before. We've got the green for the oxygen, blue for nitrous, yellow for medical air, and then the waste gas disposal is the purple. So I want to show you how to put these in. And they can only match up one way. So you want to look at the pins and you want to line them up with the way the pins are oriented for that. You just push them hard in. So now we're going to do the oxygen. And you got to line up the pins and just really shove it in there hard. And like I said, some offices have it. So there's the medical air, and here comes the nitrous. And to pull it out, it's a lot easier. You just take and turn the knob clockwise, so to the right, and it just pops out real easily like that. And that's it. So this office that we're gonna see right now before our break has those quick connects. All right, very good, you guys. Can you name the drug that would be probably your first choice if it's not a severe allergic reaction that you would give a person, especially if they had like an IV going? I know it's going to be tough since you're just going to be in offices that don't have IV, but you're still going to have an emergency drug kit that's got a pill form of this drug. Can you think of what the drug is? It's not on the test, so it's okay if you don't know. One of the first drugs you'd give somebody that has hives.
I mean, is it just like basic loratadine or Benadryl?
Exactly.
Because I know like severe anaphylaxis is epi, but you're not talking about that. You're talking about like light. So
Right. Yeah. If it's something that's manageable, it's gonna be,
Mhm.
it's gonna be Benadryl or diphenhydramine. Probably you've got that in your cart. So this movie that we're gonna see again just before the break is the way I don't want you to do nitrous oxide. They make some errors there that I want to point out to you. It's not the worst thing in the world, but the system that they're using is really, the system for the mask is not real nice, and the technique that they're using is something I don't want you to see. And sometimes, or use, sometimes you need to see that to be able to treat a patient. All right. So she's going to go ahead and plug those plugs in. Like I said, dental offices and clinics have these plugs too. So there's the vacuum or the suction to be able to exhaust the waste gas. Then we're going to have nitrous oxide and oxygen she's going to plug in. And you can see where those dials, if you turn them to the right, will release the hoses from the wall. So she's going to go ahead and have cleaned this all before the patient gets there, the tubing and everything. And she's going to show you the tubing that's set up for the scavenger and the other one for the fresh gas here in just a bit. And this mask system that they've got, I'm hoping you guys don't have it in your offices, is a real unforgiving, rough, hard plastic that doesn't bend very well, and it's got a bunch of plastic pieces. Do any of you guys use this kind of a mask? Because someone inevitably is going to break this plastic or throw it into the trash. And there's so many little pieces. There's the blocker hose on the far right, and there's two plastic pieces, and then there's the part that attaches to the mask. So here's the hoses, the two hoses. She's going to show those in just a second. You can see one of them says vacuum, so that's going to be the scavenger, and the other one is going to carry the fresh gas. So this will attach with a lot of might. That goes to the scavenger side. And the reason I say that a lot of might is that this plastic is just, even these hoses, is so unforgiving. So I'm glad you don't use those, but you may see this, these masks are still around. And they actually have to stop the film for you to be able to see what's going on with being able to get that together. So just very unforgiving. You do this way ahead of the patient getting there, rather than sit and fight with it and waste time. You can see it's quite the struggle. So they stopped the film. They finally got it together. So this is going into the scavenger side. And again, it's just not real easy to attach it. So I want you to see a bad system. Again, you might have to work with it sometime. And then that vacuum scavenger hose, once she gets that assembled, is going to go into the very end of that plastic device, that blocker that she's putting in. So we're about almost there on the assembly. This other piece will go here. This is going to be for the fresh gas. And then you'll hook the appropriate hose up to that. I would be so frustrated with that system. Finally got it. They make a lot easier systems now. You can attach a mask like a nasal cannula to a patient. All right. Are you guys still with me? Are you guys okay?
Yes, still with you.
All right, awesome. All right, Reagan, great. So there's the fresh gas. It's going to go in there. Hopefully this thing won't break apart. And there's the scavenger side. And then we're going to go down to the head unit now and look to see, and we're going to have a patient in the chair. She's going to have flipped it on. So this is the scavenger. Instead of a ball, it's got a needle, and there's the sweet spot. It's going to be that green area. And this is where the dial is to dial in the suction. So you'll either tighten it or loosen it and get the needle smack into the sweet spot of that green area. So let the patient put it on. It's good that they've got glasses on. And they're going to put a 2x2 because there's just to cushion the top of the mask. That's never a good idea. You want a good, firm, but not pressured seal there so that the patient's just breathing what the nasal mask is giving them. And just don't cinch that up too tightly. Okay. There's the 2x2 going in, and it's going to blow fresh gas all over the patient's eyes. So when you go to put the nitrous mask on, the oxygen nitrous mask on, always have gas flowing. So we'll see in a little later movie, I did not have the gas flowing. And that was a good learning experience, but they should have gas going. Some people will breathe, not get any gas, and it'll really panic them that they're not breathing any gas. If you look at the reservoir bag, you're going to see it rising and falling, which is excellent. That's a good seal. So if you watch that, you'll see that they've got a nice seal there with the mask. So there we are, kind of collapsing, and now it'll expand out. It's a little bit difficult to see. And every one of these machine head units are about the same. So we're going to give them some oxygen for just a couple of minutes, but we don't want the patient to talk. So just ask yes, no questions where they can shake their head. So that 7.0, 7.2 is fresh gas of oxygen. Notice it's a green number, and that's way too much gas. And then you'll saw to the left there that it says 100. So they're breathing 100% nitrous oxide. I'm sorry, oxygen, no nitrous oxide. And it's really only necessary to do this for about even just about a minute or so. In fact, I would put it on let them take a couple of breaths and start titrating in your nitrous right away. When you got them into the happy spot with their nitrous, so that they're in there where we want them calm and relaxed, then you can put the topical in and start localizing the tissue, the teeth. So there's 100% oxygen with 7.3 liters per minute, and that's just way too much. Now the patient's getting 5% nitrous oxide, and that's just not enough to be able to do anything. If I were to start, that number would be about 80, maybe 75% to start things off instead of a 95. And I would have that oxygen fresh gas flow rate down, way down as far as I can get it, so I'm not wasting gas. Questions, anybody? So she's kind of waiting too long to do this. You just ask the patient yes, no questions, and I can tell you they're not going to feel it at 5% nitrous. So she's going to get bold with this, and she's going to take him to 15% nitrous here in just a bit. And that is just not enough for, I would say, probably your majority of patients to be breathing it. And just ask them yes, no questions, no talking, because they're diluting that nitrous you're giving them with oxygen. So no talking. So there's 85. That was 15% nitrous. Now we're only at 10% nitrous with way too high a flow rate again. So it's just not enough to even see anything or to register anything. So we're watching now, and she's still not feeling any effects. So this is part of the titration process. And notice she asked a yes, no question. So now they're at 15% nitrous, which really is still not enough. I would not bring this titration up so slowly. Like I said, I would have started them at about 20% so that that number read 80. So 80% oxygen, 20% nitrous. And eventually then she's going to reach that point of just being really relaxed. And you'll see, just don't talk. You can see she looks a lot more relaxed with her eyes and her lips, but we just don't want that talking. Want a good seal so we see the bag collapsing and expanding. And if you look up over her head, you'll see that bag rising and falling really nicely. That's a good seal. No talking, because you're diluting your nitrous and you're not getting done so you can get on with the dental procedure. Just relaxed and calm. That's what we should be feeling. Way too high a flow rate, like I said. She's just pointing out some buttons on the machine. They're all going to be different, but they all have the basic same effects. That tells you how much nitrous was flowing, and the other is showing you how much oxygen is flowing in liters per minute. And it's just, like I said, way too much. So now the dental procedure's done, or it doesn't have to necessarily be at the end. You can start to wash the nitrous out as you're getting toward the end, like maybe when you're putting on temporaries or you're doing periodontal scaling or whatever, and you're not quite at the end, but you're pretty darn close and they're comfortable because they're numb or whatever. It's okay to start backing it off. And like I said, we're going to want to sit the chair up slowly and let them really equilibrate so that they don't get dizzy or anything. So that can come off, and they might be disoriented or dizzy getting up. So just kind of keep that in mind. Questions? All right, good job, you guys. That's the titration thing. With some of the students in class, I call it the T word. So very good. I just want to show you before we take our break, the reservoir bag and how important that is. I know I keep teasing you with this break. I promise you'll have a break. So there's the reservoir bag. Remember, it's got to be about 3/4 full or so. But this movie shows you how the reservoir bag comes into play and what the patient is going to be breathing from. So you can read what the bag does there. It's a reservoir of gas for the patient to inhale from. And it's on demand. It's not forcing it into the patient. So we're going to turn on this movie. They're going to breathe, and they're going to breathe the molecules that have been stored in temporarily in that reservoir bag. So that's going through the fresh gas. And then when they breathe out, it's going through the scavenging gas or the scavenger. And that suction has to be adjusted just right. And that's really all it is for a reservoir bag. So we don't want it overinflated. It's got to be just about 3/4 full, and we don't want it flat. Okay. So why don't you guys, we're right at about 8 o'clock. I've got like one minute to 8. Let's come back at 8:05 and we'll go through the rest of our movies and talk about things. So I will see you in a bit. Okay, so these are the valves that fit on the top of the tanks, and they're the same for either the little tanks, the small ones that go on the portable machine, or the ones that fit on the big tall tanks that are in the tank closet that you get chained to the wall. Just notice that those pins are really far apart here, so that's an oxygen tank. And if you look at the threads, I'm going to try and get this out of the way, you see they're really fine threads. So there's no way to confuse it with the nitrous that's got the pins in another spot and really coarse threads. So you probably will never see that again, but I just want you to see what those valves look like. And we're going to do the same thing that we've done with each of the other types of machines that we've got. We've got a portable machine. We're going to assemble the mask. This is my machine up in Minneapolis when I give my course up there. We're going to adjust the scavenger and you'll use the volume control right here and get the ball floating. We don't get it perfect, but we're going to float it right in that white spot there. That's that sweet or the happy spot. I like to let the patient put the mask on, and we should have gas going, but you can see here, there's no gas going. So that was a bad Dr. Schwartz. And we'll get some glasses on the patient. So that should have been on. Let the patient put it on. Make sure that they're comfortable. A pillow underneath the knees. Nice comfortable neck pillow. Whatever. So that the patient is breathing comfortably and that they're sitting there comfortably. And notice that, I'm going to pause it. Notice that the machine, we just turned the oxygen on with the tank key. It is set to leak at 3 liters a minute. Like I said, if I turn this dial and crank it all the way to the right, it's still going to leak 3. So we're always leaking oxygen, which is great for the patient. It's just a built-in safety measure. And you don't have to open the tanks full wide, but we're going to go ahead and open them up till you see the needles move. And make sure that they're breathing well. Oxygen is moving, they're positioned comfortably. If you have to put a blanket on them or take a blanket off so that they're comfortable before we start. And then just some slow, deep breaths. And then we're going to start to titrate in the nitrous. It just has to be a minute or two. And again, every patient is different. So it's going to be lefty-loosey to open the valve, to loosen it up. So we've got it now at 1 liter of nitrous and 3 liters of oxygen. And you'll probably want to have access to, or you will want to have access to a calculator probably, so that we can do some calculations of what percent, this is Tammy, what percent Tammy is breathing. Stop me if you guys have any questions. I'm watching over on the chat. And rather than talking, let's ask yes, no questions. So we want the feet apart, something under the knee so that they're not straight like that, so they're bent slightly would be an excellent thing to do. And like I said, if they need a blanket or not, we're going to go ahead and put that on. Big, slow, deep breaths. And then you just ask the patient, we're going to bring up a little bit more nitrous in this case. So now we're at 2 nitrous and 3 oxygen, 2 liters per minute and 3 liters per minute. Give them a good minute or so with some deep breaths. You're going to know pretty quickly whether they're comfortable or not. Like I said, just don't make this cinch too tight. This might be a little bit tight right here. Big, slow, deep breaths. And if we have to bring up more after about maybe a minute or so, then we're going to go ahead and turn up the concentration again. Because Eduardo, you talked about where they had the knee or the balls floating at the same area. So, and Tammy was happy there. So we're going to go ahead and let it wash out now. So you see, it just give them the amount that they need rather than a set amount. Because some people might be really unhappy at 50% nitrous. You know, it might be too much. So we'll let her breathe that off for a good couple of minutes. And you guys, I know that I'm repeating myself, but that's how easy it is to give nitrous oxide to a patient. It's really very simple. You need to know about what the machine does, and you need to know about gas flows and concentrations and making sure that the machine is functioning properly. But here's Tricia, we're going to do the same thing. She's going to put the mask on. There's going to be gas going. We want that reservoir bag about 3/4 full, so it's a little bit limp looking up there at it. I would use the oxygen flush button to kind of flush some gas in there. And then I would start bringing in the nitrous like right away. There's her safety glasses. And that really is all there is to it, you guys. How to turn it on, how to set it up, how to shut it off, how to adjust the scavenger, how to adjust your gas flows for the lowest amount possible, and just titrate it to effect. But like I said, if they'd been in before, if Trisha had been in before and she loved it at 25%, I would start her right at 25%. You don't have to retitrate. This is like an initial visit. So we're at 1 liter of nitrous and 2 liters of oxygen. And again, as I said, we're going to calculate to see what that percent is, because this machine does not do it for you. Big, slow, deep breaths. Breathe in and out of your nose. Big breaths. Try not to talk. And just kind of look for the thumbs up. There's a big breath. Big, deep breath. So we're gonna titrate in just a little bit more nitrous on Trisha. She's still not quite feeling it where she's in that happy place yet. So you just bring it up in small increments. And then once you, as I said, hit that place where she's happy and she's relaxed, then you'll go ahead and put your topical in and start your local anesthetic in just a bit. Because they still need that. So she's talking there, that's not good. Well, we are looking for the thumbs up. So the gas is traveling everywhere in her body, down to her legs, down to her feet. There's the thumbs up, her shoulders, her neck. We want it to go to the brain. That's the spot. You can see that bag's much nicer looking. That cinch isn't too tight. Sometimes I don't even use it at all, but it's okay if you do. So we're going to go ahead and turn righty-tighty the knob to turn it off. And then we can crank up the flow of oxygen and just let that breathe off. But we left it at 3, which is fine. The reservoir bag looks good. And that's all there is to it. We're going to have one more patient. Do you guys, I'm looking at the chat. Do you have any questions? Okay, good. Okay. And that's really all there is to it. It's nice. I don't know if you remember from your reading, but nitrous oxide is the weakest inhaled general anesthetic. It's got the weakest amount of strength because we used potent inhaled agents in the operating room to keep a patient asleep. In fact, if I'm giving somebody about 2.5 or 3% sevoflurane, 3%, and I could be giving oxygen or air for the patient, that's enough to have your gallbladder worked on, your heart, just whatever. So the agents are strong. Here's Diana, and she's chewing on gum. So she's got her safety goggles on. She's looking cool, her safety glasses or sunglasses. Does a patient have to be NPO, nothing by mouth, for nitrous oxide? Can they have come in having just eaten lunch at Jimmy John's and had a nice sub before they came in for their appointment? Do they have to be NPO? In this case, for nitrous, it does not matter. In the rest of the anesthesia world, it matters very, very much. It's kind of it's not a law, but it's just a guideline that everybody follows, that it's 2 hours for clear liquids, 6 hours for a real light meal, and 8 hours for a big heavy meal like a Jimmy John sandwich or whatever. That they can't have had anything, no water, no nothing. 2 hours for clear liquids. So you're right, they can eat. But if she were having an IV sedation, we'd have to make sure we document and that they're honest with us about what they've had to eat. And for real non-compliant patients coming around the bend that we see in the anesthesia world, there's the thumbs up. We've titrated that in on Diana. But in the anesthesia world, if it's a group of patients that you're working with that are not reliable, it might be a clinic of some kind, they've got an ultrasound. It's a portable ultrasound that you can put over their stomach, and you can even watch on your TV screen of your iPhone or your Samsung or whatever, your Android, and see if there's any food in the stomach if they're non-compliant. It's called point of care ultrasound, and they nickname it, of course, POCUS, POCUS, point of care ultrasound. They've come down from these giant computers to something that looks like a larger than an iPhone. It's really pretty amazing. And she's just going to breathe off the nitrous now when we're done with the procedure. Does anybody have any questions? Just realize again that NPO is still used, but not so much for nitrous oxide. All right, good.
I don't quite understand the question. By greater effect, you mean like making the patient relax or?
Right, or could be a bigger anesthetic for the patient.
Okay.
Remember we use something that's additive in the notes.
Mm-hmm. Okay. Mm-hmm.
So the more that you add together, I'm waiting. Eduardo, do you want to just tell me your answer or you can text
Oh,
it?
well, I chose B.
You
Mm-hmm.
chose B. Oh,
Nitrous and local anesthesia. Mm-hmm.
all right. I didn't see yours come through on that.
Mm-hmm.
So if you've got nitrous,
Mm-hmm.
someone's coming on here. Okay. All right. So if you've got nitrous and Benadryl, which you know they put in nighttime cold medicines, and you've got local anesthetic, those are going to all work together. Hi, Dila.
Mm-hmm. Mm.
Those are going to all work together to make a big anesthetic. So it's
Okay,
gonna be
so
bigger
the
than this
answer
one.
would be C.
Right, so it would be C.
Okay.
So
Mm.
Okay,
they're
that
all
one
add
threw me
together.
off because I feel like you'd only use Benadryl on like if they're having a reaction. So I wouldn't think you'd give it naturally just to make it a deeper sedative, but
Right.
I guess that
Some
makes sense.
people do. They'll
I
add
guess I thought too much into it.
well, it's good thinking, but Benadryl, remember, is in sleepy cold time medicines and it does not shut off breathing. So if you add
Mm.
those all together, it's going to make for a big anesthetic for the patient. So they
Okay.
all work together. So in other words, their strengths are additive. They all add together to make a big anesthetic. Now, if I said, gosh, what could I put in there that would make it something that's bad? You know, a high-speed drill and local anesthetic, whatever, that would not add together to make a big anesthetic for the patient.
Okay.
You know what I'm saying? I can't think of anything like right off that would do that. If they've had
Maybe
marijuana,
Valium.
yeah, that would work. That would work. And states frown on the fact that you're mixing things unless you have the correct permit and be able to treat it if they have a reaction, if they go too deep. So let's try another one here.
I don't know. True.
All right. Remember, a two is a smoker is always a two.
Oh,
So they
always a
can be
2. Okay.
healthy. This can be LeBron James here, but if he's shooting on a cigarette or smoking a pipe or something, he's a two, even though the guy's in great shape, you know?
Okay.
So restudy your ASA physical status on your during your lectures. Of course, you're gonna look everything over, but, all right,
Mhm.
we got a
Okay.
couple of fun movies, and hi, Dila, I see you.
Hi, how are you?
We've got Eduardo out in San Francisco, and we've got
Hello. Mhm.
Ray out in, where were you? I thought you said San Francisco. Eduardo,
I am in San Francisco. I am
Okay.
in San Francisco, San Francisco. Mhm.
okay. And then Ray is over in Columbia, Missouri, and Dila's in Ventura, California. So
Mhm.
very good. All right, so we're gonna see some kind of fun movies that you'll probably, I hope, never ever see again. So let me get that teed up. And I know that this is not an operatory. I don't think that you guys have tires and saws and a free tank standing there that's black, which is probably either a nitrogen tank for a acetylene torch type thing, or it could be carbon dioxide's that color too. It's kind of a gray. So we're gonna take and we're gonna back the old forklift that you have in your operatory into that tank and knock it over, and it'll be a yellow tank. It's gonna change to a yellow tank here in just a bit. So don't worry about the numbers. That's probably a nitrogen tank. The yellow one that you're gonna see is an acetylene tank. So you've got all that pressure. So that is a rocket, it's a missile, it's a bomb. So treat it very gingerly. So they're gonna bump into this, knock off the valve, and it can shoot through a concrete wall. And if there's somebody standing there, they're gonna be severely injured. Here's a nitrous tank taking off like a rocket, going up through the roof, doing a couple of twists, coming back down. If it hits somebody, you know how much they weigh, and it's coming at a lot of speed with it as it falls from gravity. It can crack the concrete. So really respect those. If you've got a tank, do not leave it suspended. Take it and lay it down and be really careful with the valve. Here is a tank farm, and this is a newbie that's standing up a nitrous tank, and watch what happens. That is for real. Here's a guy that's messing with a valve on a tank, and I want you to see it take off like a rocket, and he's gonna lose his balance big time. So this, I'm gonna go back just a hair, is an oxygen tank. This is on a guillotine, so the guillotine's gonna chop the valve off, and this is gonna take off like a rocket, and right over here is a fake house. Grandma's in there doing her knitting, minding her own business, and someone's in the kitchen making some porridge. So watch what happens. This is for real what it looks like. There goes grandma in the rocking chair. There goes the doors. There goes the wall. And it just still coming. It comes very fast. That's kind of slow motion. So again, respect the cylinders. I think you guys have that. Are you all familiar with what a whippet is? You can text me a yes or a no if you've seen that. Have you seen that, Dila?
No.
No whippet? Eduardo? So in the days before the can of Ready Whip or whatever that you shake and you push down on the white knob on it, they've got a whippet. And this, you can buy heavy whipping cream in the store. It's where the milk and all the creams are. This is just a container for it. This is the top that screws on. And underneath here is a little miniature tank of nitrous oxide. So when you squish the button, the nitrous mixes with the whipping cream and it comes out the end, and you can put it on your pumpkin pie or decorate or whatever. So this is what one of those little tanks looks like. I'm gonna put my thumb and my middle finger there. You can see how big it is. They're pretty little. And that's just a small tank of nitrous. You can buy these in restaurant supply places. So I wanted you to see that because This is kind of interesting what they did with this. All right, so this is in a science lab. This is an ultra cold container or refrigerator that's got one of these whippet tanks in the bottom of it. So here's the whippets over here. You can see one of them is kind of sticking up over the edge. So they put that in there to get this tank really cold. And we're not talking about a freezer here. We're talking about a super freezer. So he's got on special gloves because he would burn his hands from the cold. There's the whippets. To make whipping cream. He's going to take the tank out and he's going to activate it using the thing from the Whippet company. So he's going to take it and put it in that cylinder, screw it on, pop the seal on the end of it, and then take the whole thing off quickly. And he's got a test tube in there that's also getting ultra cold. So he's going to pour liquid nitrous oxide. You'll never see this again. And this is what it looks like. It's going to be boiling at room temperature. So that is boiling nitrous oxide. And the vapor comes off, and that's what's in the top of the tank. So that's what nitrous oxide looks like. He's going to put it in there and let it get cold again. Now he's going to put it in a beaker and throw a match in there or a lighted stick. Watch it. So there's no oxygen in that. It's just nitrous. And you can see it's still boiling and bubbling over there. Here it is slow motion. So nitrous will support a flame. So you got to be really careful with anything sparking, heating, no lubricants that are petroleum based at all. Okay. Do you guys have access to, I'm going to need you to have some paper and a calculator. I don't know if you want to use the calculator on your phone. Are you guys good? Do you have all that stuff? So I want to do some math calculations with you because, like I said, some of the machines don't have the calculation. So let's take and go through them. There's all different types of head units. This is the one that is inside a cabinet, and you can see it's got there's blue, so that's the nitrous side, and here's the green and the oxygen side. I don't see the green real well, but the numbers are green. And this little dial here tells you the percent nitrous. Here's the head unit that we used from Minnesota, the one I was showing you with the built-in 3 liter per minute leak. But it doesn't have any kind of calculation on it. And you're going to run into these, and I want you to know how to use them. Here's a real nice electronic. Here's that Accutron company. When we saw the early manifold pictures, that was an old Accutron central system, but you can see they're running 50% nitrous, 7 liters per minute of gas flow, which is way too high. Here it's telling you there's 3.5 liters per minute of nitrous and 3.5 liters per minute of oxygen. This is also a cabinet system where you titrate in the oxygen and the nitrous, but it doesn't give you the percent, so you have to be able to calculate it. And then lastly, this head unit, you'll turn up your oxygen and then you'll bring your nitrous in, and there's a little dial right here where I'm kind of tickling it up and down that tells you the percent of nitrous that you're giving a patient. Questions on that before we go on? Okay, good. All right, so let's talk about this molecule. Remember to read the middle of the balls. So when the ball's floating, you read the middle of it, not the top or the bottom. So what I want you to do for these calculations is you're going to take the flow of nitrous in liters per minute, add it to the flow of oxygen to get a total flow. And it's just a simple algebra equation. Then you're going to take just the nitrous and divide it into the total flow. So I've got a bunch of examples for you. We're going to add them together. So look at the balls, read the middle of the ball, and tell me what percent, just send me a chat of what percent of nitrous this patient is breathing. Remember to add the nitrous and the oxygen together, and then divide just the nitrous into the total. And it's that simple to calculate. Very good, Reagan. Eduardo, are you okay with it? Okay, good. So let's look at it. We're going to have a bunch of these questions. So
Okay.
add them together. 1 and 2 is 3,
Mhm.
okay? And then
Mhm.
divide the nitrous into the grand total. So 1/3 is 0.33 or 33%. Sorry that there's a fire truck going by. So very good. So we're running really low flows here. And this is where the patient might love it. 33% is a nice number to start them out at. But like I said, I start them out about 20, 25%. Let's do another one. And just chat me your answer. Exactly. So the patient's brain, we're going to add them together. 2 and 4 is 6, and 2/6 is 1/3. So the patient's brain is still getting 33%, but now look at how much gas you're wasting. That's why I want you to use the least amount of flow possible. So the rest of it isn't leaking around the mask, leaking into the room, and you guys are breathing it. And you got a patient every day or every hour or every 3 hours or whatever. I don't want you breathing nitrous oxide molecules. There's some things that can happen to it, to your body, if you're breathing it chronically. So same brain's getting the same percent, even though the flows are doubled. So let's do another one now. Eduardo, do you have it okay? All right, good. Okay. So again, add them together. 1 and 3 is 4, and 1/4 is 0.25 or 25%. Okay. You can almost look at the floating balls there and tell me what the percent of nitrous is that they're breathing. Because of them being together at the same height. So go ahead and calculate that out. Good. 1.5 and 1.5 is 3, and 1.5 divided into the grand total is 0.5 or 50%. Very good. Let's do another one. All right, good, you guys. I'm glad you're getting it. So 2 and 3 is 5, and 2/5 is 0.4 or 40%. Very good. So this is what is called a normal distribution curve. And if you're doing a study on people and statisticians use this, it looks like a bell, and they call it a bell curve. If you look to see it kind of, this is where the string would be up here, or the rope for the bell. So the majority of people are going to be around in this area. So this is called a bell curve. And I'm going to take you down to the next slide. And you can see this is where people like to have nitrous oxide, how people do, the majority of people. So you can see that it's a bell curve. And if you start somebody out at 20 or 25%, where I'm tickling the drawing right here, you can see that we're on the left side of the bell curve and not a lot of people are there. But as soon as you go up to 30%, 30, 35, 40%, people love it, the majority of people. So this is 21 and 25 is 46. So that's about 90% of people love it at about between 30 and 40%. It's just going to depend on the person. Now, when we did nitrous in Minneapolis, where I was teaching this class, good old Dr. Schwartz was out here at 60%. So what can I tell you? I just needed more before I felt it. So, all right. Questions from you guys? All right.
How do you know if it's a patient is getting too much?
They'll tell you. They'll start to maybe fall off to sleep, or they might get sick to their stomach and nauseous, or start sweating, and just be really uncomfortable. So we want to use the least amount of concentration as possible. We don't want to bombard them with a lot of nitrous. All right. So just some reminders for you guys. You can write these down. You guys have your paper? You guys good on paper, or to write down some notes and some phone numbers and emails and stuff? Okay, good, Eduardo. Reagan, are you good? All right. So I'm going to give you one more learning module to study so that you get your hours in for your class. So if you go to the sedationconsult.com website, this is what the home page looks like. So here's sedationconsult.com. Hover over the online essentials, and you'll get a drop-down box, which looks like this. The second one down is Essentials of Nitrous Oxide Online for Dentistry Parts 1 and 2. So click on that. And down on the right, about maybe half to 3/4 of the way down the page, you're going to see it's called Putting Nitrous Oxide Together. So it'll take all your 9 learning modules and put them into a spot where you can just really get an idea and pull all your thoughts together into one. Okay. And then if you look just below this, I have a practice exam for you with 10 questions. They're not on the exam, but you can see how I write questions with that. Can you give me a thumbs up or a good? Are we good so far? Okay, great. All right. And then when you feel like you're prepared, I'm not rushing you. I can check to see that you're doing the that you've signed up for the nitrous oxide for the putting it all together. So when you feel like you're ready and you've studied your last module, because I need to give you credit for that hour, contact one of our test proctors to schedule your exam. So I'm going to give you information on that. It's 104 questions now, and it is, so you have to have a 78 at least to pass. You're going to have multiple choice, true, false, and fill in the blank. So you need a score of 78. There's one extra question on there. So are you guys going to be taking this during the day? Anybody taking it in the evening at all, or on a weekend? Reagan's during the day. So you have to find out if you're taking it on a day or a weekend. Okay, you don't have it scheduled yet. All right, that's fine. So the person to call, our lead test proctor is Sherry, and this is her cell phone number. Okay, yeah,
Doctor, so sorry. The
Go ahead.
103 questions is all about nitros?
yes.
Okay.
Do you want me to add a few?
No, I just think that it's a little too much
I'm gonna
just for
write
nitros.
I'm gonna write a special test for Eduardo. No, there's
I'm
so
like,
much.
what can you possibly ask for
Oh, you'll
103
see. You
questions?
saw there's 9 modules there. I had a lot of stuff to go on. There's a lot of stuff to know about nitrous. It's
Okay.
all right, and you probably know with the way that you guys are answering tonight, you guys are really sharp on it. So you can write this down. Sherry's number. She does daytime testing. Andrea does evenings and weekends. And then Jenna does just usually evenings, no weekends. And Sharon just kind of fills in on all the different time slots. So we make sure we take care of you guys. And they all read assesslive@hotmail.com. That's their email for all 4 of them. You guys got it okay? Okay, good. All right. So then I also need you to email me, or I want you to email it, not to me. I want you to send it to sedation consult, all one word, at yahoo.com. Sedation consult at yahoo.com. I need a selfie, a copy of a photo ID. I didn't even look at it, Reagan, yet. So I don't know. If you sent it, then we've got it. If you want to resend it to the Yahoo email, that's great. And then send a copy of your BLS and if you have an ACLS card, your CPR card. You okay, Eduardo, with that? And we keep a file on all you guys. So if the board asks questions or if you should go to another employer, we've got all that stuff in a special file that I store in the cloud for you. All right. And then anything with questions over the material, anything that we've been through tonight, anything with the notes or the modules, that's my cell phone number. And that's my email number. All right. You guys, that's all I have for you. That is it. So if you don't have any other questions, I had a great time with you tonight. And Eduardo, after we finish up, would you mind if we talked on the phone privately for a minute?
I don't mind at all.
Okay, will you call me then?
Yes. Okay.
All right.
I will call you. All right. Thank
Everybody
you.
have a wonderful
Um,
evening. Thanks for coming in. Dila,
I
see you. Yes, Reagan.
I actually have quick question only because since I was licensed in North Carolina, there's a couple things here that are different. Um, in regards to the lecture material, a lot of it just confused me to the aspect of scope of what I'm supposed to do in like the medical emergencies concerning nitrous portion specifically, only because it talks a lot about like severe things like laryngoscopes and if you need to do like an emergency like tracheotomy in a realistic situation, I'm just supposed to go get the doctor, right? Like
Yeah.
other than something obvious
Yes.
that I can control, like turning the nitrous off and flushing with like 8 of
Right.
oxygen. I'm just supposed to go get the doctor and they do the rest, right?
You're going to be partially right. You're going to be an educated, other than a bystander. You're going to help him or her.
Well, yeah, you'll help. Yeah.
And
Okay.
you should be educated to know. So like on the test, I might start doing something and I want to know what the emergency is. but you won't be doing
Okay.
laryngoscope and putting in an IV unless you want to learn to do that sort of thing. In Missouri, they don't let us do IVs, and I'm not sure about California. But
Okay.
you have to
Okay.
be an educated individual to know what he or she needs to help the patient. Okay.
Okay, so
So-
that's where my confusion was, is it was saying like some were specific as to get these things ready, which I was then able to infer that that means have it ready for the doctor to use. But then other ones were talking about, go ahead and do this. And I was like, I can't do that. So I just needed to make sure that it's the
Right.
same in North Carolina to the capacity of I
Right.
don't do those things. I just assist. Okay.
Exactly. Now,
Okay.
if it's CPR, there's always an
Then
exception
obviously,
rule. Then
yeah.
you've got to follow your CABDs.
Right.
You start doing your compressions, call for help. Airway is not as important anymore. We're not even really breathing for the patient now, but an advanced airway,
Correct.
a
It's
bad
just
valve
pumps.
mask,
Yeah.
which they've got in your office, and early defibrillation.
Mhm.
So you're going to follow those, and you're going to be more than a bystander there. You're going to be educated.
Okay.
That's why you've got your CPR. So I know that that was kind of a roundabout answer, but I hope that helped you.
Yeah, it did. That was great. Thank you.
All right. I'm going to turn off the recording. Eduardo, if you would call me in just a second here.